In this video, you'll learn how to break down priority questions using clinical judgment, ABCs, and Maslows, so you can quickly determine who needs you first. Let's get right into it. If you watched episode 1, you already know how to recognize the cue, interpret what it means, and identify the high-risk concern. If not, you can go back to that foundation video after this. Before we jump into the example, here's what you need to remember about priority questions. They aren't testing memorization. They're testing whether you can recognize risk in real time. You're starting off by identifying cues that stand out, then interpreting what those cues mean for the client, and finally determining which cue signals the greatest threat. ABCs and Maslow's hierarchy help you organize that risk. Remember, airway comes first, then breathing, then circulation, and physiological needs form the foundation for all priorities. Let's walk through an example together so you can see how the decode fits into a priority style question. Here's our example question. You'll see in this particular question, the information we need isn't in the stem. It's in the answer choices themselves. As you scan these 4 clients, focus on details that signal a change or a higher level of risk. That's where your decode begins. Now, let's walk through the decode step by step. Start by looking at all the cues that stand out in each option. One client with COPD becomes short of breath with exertion. One post-op client is reporting pain at an 8 out of 10. One client with pneumonia has a respiratory rate that increased from 20 to 30 in 1 hour. And one client receiving antibiotics is now reporting nausea. Let's interpret each cue and connect it to our priorities. The COPD client becomes short of breath with exertion. That is an expected abnormality for this condition, and without a new change or increased severity, it does not rise to an airway or breathing emergency in the ABCs. The post-operative client reporting pain at an 8 is uncomfortable, and the pain is a physiological need under Maslow's. But pain alone does not signal deterioration or immediate threat to airway breathing or circulation. The client receiving IV antibiotics, who is now nauseated, is also experiencing a lower level physiological need. Nausea is uncomfortable, but it does not threaten airway breathing or circulation and does not indicate an unstable change. The client with pneumonia, whose respiratory rate increased from 20 to 30 in 1 hour, is showing a significant change in breathing effort. A rising respiratory rate signals increased work of breathing and possible early respiratory decline. Any cue that affects breathing moves immediately towards the top of the priority list using the ABCs. When you organize these cues with ABCs and Maslow's, the rapid respiratory change becomes the clear priority. Now that you've seen how the decode works with priority questions, it's time for you to give it a try. Before we walk through this one together, pause the video and work through the decode on your own. Write down each step, the cues you recognized, what those cues mean, how you organize the risks with ABCs and Maslow's, and which client you choose as a priority. When you're ready, press play and we'll go through it together. Let's decode this question together. Start with the cues. The client with diabetes has new numbness in both feet. The heart failure client gained 3 pounds in 24 hours. The client with asthma is having mild wheezing after using their rescue inhaler. And the post-op client has a blood pressure of 92/58. Now let's interpret each cue and connect it to our priorities. New numbness in the feet is concerning, but reflects a gradual peripheral issue, lower risk under the Maslow's physiological needs. A rapid 3-pound weight gain in heart failure signals fluid retention, but without respiratory distress, it doesn't outrank airway or breathing concerns. Mild wheezing after a rescue inhaler indicates airway irritation, but because it isn't described as worsening, it doesn't rise above more urgent needs. The post-op client with a blood pressure of 92/58 shows possible hypoperfusion or early shock, directly affecting circulation. Circulation issues can quickly become life-threatening. When you organize these cues with ABCs and Maslow's, the post-op client with hypotension becomes your highest priority. This is why practicing the decode matters. The more you break down the cues, interpret their meanings, and organize the risks, the more natural priority questions become. When you slow down and work through each step of the decode, priority questions stop feeling overwhelming. You recognize the cues, interpret what they mean, and organize the risks using ABCs and Maslows until the answer becomes clear. Keep practicing this process. The more you use it, the faster your clinical judgment will grow. In our next episode, we're going to take this same framework and apply it to select all that apply questions so you can approach them with confidence instead of guessing. I'll see you there.